Salim. Salim is a star resident, and I would trust him with the care of my loved ones. This is a trait we want all residents to have, and it is essential that they have the knowledge, skills, and attitudes so that we would feel comfortable having them treat patients, including our loved ones. In this video, we will explore the concept of entrustment through Entrustable Professional Activities, or EPAs. We will also show you how EPAs are being used as a key component within Canadian residency training. Here's a look at what we'll cover over the next few minutes. We're going to examine what an EPA is, why it's important, and how it's used. Let's start by looking at the what. An entrustable professional activity is a task of a discipline that an individual can be trusted to perform once sufficient competence has been demonstrated. Each EPA is made up of a number of milestones, which are the abilities expected of a resident in order to perform the EPA. So let's flip things around a bit and talk about milestones first. Based on the CAMEDS 2015 framework, the Royal College has defined a comprehensive set of expected abilities of a resident for each stage of residency called milestones. These milestones are markers for teaching and learning. There are hundreds of milestones for any given discipline, which is why the Royal College has developed EPAs. For implementation to be practical, each specialty or subspecialty has created EPAs. Each EPA bundles several milestones into it. By assessing one EPA, all the milestones that are bundled into that EPA are automatically assessed. EPAs are focused on the authentic clinical activities and tasks of the discipline that are carried out day to day. For medical oncology, for example, assessing uncomplicated patients with a new diagnosis of cancer is an EPA that appears in the Foundations of Discipline stage. There are almost 20 milestones associated with this particular EPA. Overall, EPAs and their component milestones provide teachers and residents like Salim with clearly defined specialty-specific targets, which they can use to guide teaching and learning. By focusing on day-to-day teaching opportunities, which are tied to the key tasks of our work, it'll be relatively easy for us to give specific, relevant feedback to our residents. We'll know we're doing a good job when our residents start to think of us as coaches who work with them to improve. By observing learners regularly and comparing their performance against the benchmark milestones in the EPA, we'll have information to help us pinpoint problems early, while also being able to provide learners with regular, focused feedback designed to help them to progress. In the 2016-17 academic year, medical oncology will focus on a select number of EPAs from the foundations and core stages of training. As a clinical supervisor in medical oncology, we will use these EPAs to teach and coach residents and assess their progress. Based on our observations, we will record an overall assessment of our learners' ability to perform the EPA. And here's where trust comes in. If we think a learner can perform this EPA without direct supervision in the future, then we can entrust them with the task. If this activity is entrustable, then all the milestones within it have been demonstrated. If no, then the EPA is in progress, and you can break it down into the individual milestones and pinpoint where to focus learning, practice, and extra support. As residents like Salim progress through training, they will be observed multiple times by multiple supervisors in a variety of contexts. Each assessment of a learner will be one of many. The documented assessments for each learner, along with other performance reports, will be reviewed regularly by a competence committee. When the competence committee has sufficient information, they will signal that the resident can be entrusted with the EPA. Let's summarize. EPAs are an approach to work-based teaching and learning, which focuses on authentic clinical activities and tasks of the discipline that are carried out day to day. They allow a large number of milestones or competencies to be observed in one clinical activity. And they are an effective tool for supervisors to plan teaching, give regular feedback and coaching, and to assess progress. For more information about EPAs, visit the Royal College website or contact cpd@royalcollege.ca.